this isn't a selfish act, but rather a act of loving kindness towards our households, our schools, our churches, our community. And we really want to make sure that we protect all of our loved ones and everyone in our community against COVID-19. And they are really our best strategy. Next slide, please. So as you already know, COVID-19, it's a respiratory illness. Some, flu-like symptoms, coughing, sneezing. Some people lose their sense of taste or smell. Some are more fatigued, dizzy, some general or vague symptoms. Otherwise, there are those who get more seriously ill with pneumonia, which can be very life-threatening, difficulty breathing. It's passed from person to person. When we talk, breathing, singing, coughing, sneezing on one another. And we can also spread it by touching contaminated objects. Next slide, please. So just some updates on where we are. We are at the tail end of a fourth wave that really was driven by this last Delta variant. And now we're finally seeing that light at the end of the tunnel. Cases are down. And honestly, when we look at many other parts of the country, we know that our strategies work. So I really want everyone on the phone, everyone on the call who's concerned, just know that as frustrating, and apologies, I know that Adrian Garcia just put in the chat box about the Spanish version at 4. I believe the Spanish town hall will be at 5. Can someone from the school clarify that?
Yes, that's correct. Spanish will be at 5. Va a ser en español a las 5 en este mismo enlace.
Gracias. Okay, so I'll continue, and Adrián, vamos a hacerlo at a las 5. Son las 5. Okay, now moving right along. What we've seen is that because of our strategies, compared to maybe some of the other approaches other states have taken, whether when we look at Florida, Georgia, other parts of the country, they're still struggling with COVID-19 infection rates, and you look at their hospitalizations. Some of that is because we've been very vigilant, wearing our masks, continuing our social distancing, hand hygiene. I know our schools are taking very seriously air filtration systems and improving ventilation, as well as cleaning our schools. We talk about electrostatic spraying. There's all sorts of strategies that our schools are employing. Because of that, infection rates are actually really down. And so that's a great thing. And I really applaud each of you for doing your part. And one of the best things we can do, of course, to continue this downward trend is to get vaccinated. Our concern is that as we move forward, we're here now in November, we're in the fall season. As we move towards winter, cough, cold, flu, and COVID-19 season, that we're going to see an increase. So the sooner we all get vaccinated, including all of our children who are eligible, the less likely that the fifth wave will be concerning, troubling, won't cause so many people to fall seriously ill or die. And we really want to blunt that fifth wave, that disease curve, those curves that we've seen in the past. Next slide, please. And just again, more data around positivity rates going down, mortality rates going down. And this is all in the backdrop and the context of vaccination rates are going up. Many parts of the county, there are communities where we're in the 90% plus. Among 65 and older, we're seeing very high vaccination rates. We still have a long way to go amongst the young invincibles, and we'll get there eventually. But just wanting people to know that the numbers are going down, the vaccine rates are going up. We're taking all these safety precautions, and that means we're really protected. And that's why we're seeing such great success right now in our communities. Next slide. So I talk about vaccines being our best defense. They've been thoroughly tested. They've gone through a rigorous clinical trials process. They're efficacious. So in order for them to have even gotten that emergency use authorization from the Food and Drug Administration, and for even the full FDA approval for Pfizer for ages 16 and older, they really had to meet rigorous data standards. And that not only proved the vaccines to be safe, but that they actually work, that they're efficacious. And we're really excited that all of us have, you know, taxpayers in this country have been able to fund these innovations, that these are free for everyone in the United States. And they're available right now. So hopefully access, we've broken down every barrier. No appointment, that's okay. No internet, no email, no cell phone. I can't walk, talk. I don't have transportation. I mean, none of these are reasons not to get vaccinated. And so we want to make sure there are no barriers. We also know that there are concerns about immigration status. We're very mindful about asking for government issued ID and the sensitivities around that. We understand in our community, there are people struggling with housing insecurity. These are all barriers that we have overcome to make sure that you get your vaccine regardless of your circumstances. Next slide, please. Just want to say that as we go to the next slide, good, thank you. Vaccines have been a very important part of our strategy throughout human history the last 100+ years. When we look at the eradication of smallpox, we don't see polio in this country anymore. When we think about measles, mumps, rubella, these childhood vaccines that we need to get in order to go to school, many of us get certain vaccines to go to work in healthcare, for example, hepatitis B and others. We get the HPV vaccine to prevent cervical cancer in women. Our elders get, and many of us get the flu shot, and many get the pneumonia shot. And as a result, older people in our culture don't die from the flu or pneumonia like they once would have. And so you really see the miracle, the life-saving ability of these essential medicines that really help us live healthier, happier, longer, higher quality lives. And that's no different here. What we have here is that we have Pfizer and Moderna, both are mRNA vaccines, and then Johnson & Johnson, a viral vector vaccine, a more traditional technology like the flu shot. Basically, all three are vehicles, and they're delivering information into your muscle cells. And in that muscle cell, you have the mRNA for making the spike protein. And then your body makes that protein, and then your body responds as it normally would, even if you were infected with COVID, by having antibodies formed that then can attack the spike protein. And if you were actually infected with COVID-19, it actually attacks the COVID-19 virus. And so really what we're doing is putting in this vehicle, this information goes into your body, makes the spike protein that your body recognizes, then your body makes antibodies. And now you've got cavalry, you've got infantry, you've got foot soldiers that are ready to protect you when you come into contact with COVID-19 from your nose or your mouth. You now are able to really fight that off. And that's why you don't end up with really strong systemic illness. It doesn't really get beyond your mouth and your nose. It protects your lungs and your kidneys and your brain and your heart and all the things that COVID-19 affects. Next slide, please. So it's really important we talk about safety. So vaccines go through a very rigorous process of clinical trials. There are 3 phases, 1, 2, and 3. And in these clinical trials that occurred over the summer and the fall of 2020, over 100,000 people from various backgrounds, men, women, Black, Latinx, they were all in these studies, different age groups, and they're continuing to be followed to make sure that there are no long-term effects of these vaccines. What we saw was that those in the earliest studies, these vaccines were really effective, and that's why they were given the green light to proceed with emergency use authorization for all these vaccines. We've been working on mRNA for some time, for several decades. We use mRNA technology to treat cancers, to deal with other rheumatological or autoimmune conditions. So as far as side effects from a vaccine, the vast majority of serious complications, what we say adverse events, happen within 1 to 2 days. And the vast majority of those are due to food and medication allergies. Then the remaining issues are all resolved within 6 to 8 weeks. That's what we know from all the vaccines that we use. And we wouldn't expect COVID-19 vaccines to operate any differently than that. Really, the information that we put in your body is metabolized and excreted through your kidneys or through your liver, and it goes out in our pee or poop, and that's it. And so while that remains is really the antibodies that your own body made to fight off COVID-19. So I really want people to hear that vaccines are very safe, and I really applaud people for having questions about the safety of vaccines. And I just really remind people, whether they're Black, brown, white, yellow, whoever you are, wherever you are, you have every right to ask your questions, and we have every responsibility to answer them truthfully, honestly, to tell you what we know, to tell you what we don't know. And so that's how we approach these vaccines as well. And I really want people to be assured with that. And I hope that we challenge people to ask these very same questions about their air quality, water quality, what's in my food, food safety, when we think about the things we buy in the grocery store, whether it's our potato chips or chicken nuggets or hot dogs. I mean, these are the same questions we should ask, but I can tell you now, what's in your vaccines: lipids that provide that information, that mRNA or that viral vector we talked about, and some salt and sugar to stabilize those molecules so they don't disintegrate or fall apart before they get inside. And that's really all that's in there. And that's similar to all the vaccines that we use. I will say also, very important that while we ask these questions, just remember the medications that we use to treat COVID-19 have many more side effects and are much more dangerous medications. So the gamble, the risk that we take often is once we're actually in the hospital, once we actually need to go to the ICU or be put on a machine to breathe, those treatments are much more deadly, much more dangerous, many more side effects, perhaps resulting in things like kidney failure, liver failure, and others. So definitely something that we want you to have some perspective and realize that right now there is this choice, and we're marinating and we're really thinking through this. Is this the right choice for myself, my family? But I also want to say that there are times when we don't have a choice, and that's when we're in the emergency room trying hard to keep people alive, and we have to give very strong medicines to try to help keep people alive. And sometimes those treatments don't work, or the treatments themselves have very serious side effects. Next slide, please. Vaccines are very effective. For example, we know from the LA data that people who are unvaccinated are 5 times more likely to catch COVID-19, and those that are unvaccinated are 29 times more likely to actually be hospitalized, and many, many more times likely to die from COVID-19. Really goes to show you that even though we're seeing quote unquote breakthrough cases where people who have received their vaccines still catch COVID, they tend to either be asymptomatic with no symptoms, or they end up with very mild cough or cold-like symptoms. People who are vaccinated are less likely to spread COVID and less likely to catch COVID, even though those cases exist. More importantly, you don't go to the hospital, you don't get seriously sick, and you don't die. And those are great reasons to get vaccinated. All right, next slide, please. The most common side effects, as many of you know, many of you on the phone or on the Zoom have already been vaccinated. You may have received your first and second doses of Moderna or Pfizer, or 1 dose of Johnson. Now we have booster shots, 3rd doses. So the vast majority of side effects is pain and tenderness at the site of injection, very similar to the flu shot or any other vaccine you would receive. That's the most common that we see. And it is common to feel those things. We also see people that feel a little under the weather, tired, fatigued the next day or the next 2 days. Some people feel fever or chills. Some people feel body aches. these symptoms usually resolve within the first 1 or 2 days, and we recommend people take Tylenol or ibuprofen and not suffer through this. It just really goes to show that your body's working. We call that reactogenicity. When your body is working well, your body is going to be producing these antibodies and doing that and being in overdrive. That's why we feel some of these symptoms the next day or the day after, and those go away. It really is a testament that your body is doing exactly as it's supposed to. Some people's go into overdrive and we need to dampen that down, and that's why I absolutely recommend people take Tylenol or ibuprofen as needed if they're feeling any of those reactogenicity symptoms, if you will. Otherwise, people go on and within 5 to 10 days, they have their full protection. So really, now having vaccinated over 300,000 people, we just have not seen any major side effects. We have not sent anyone to the hospital. We have not needed to use an EpiPen. And we've also been watching the LA County data very closely. There have been very, very, very few serious side effects from the COVID-19 vaccine, and the vast majority of them were all because they had food or medication allergies. Next slide, please. And we'll continue to monitor the situation moving forward very closely while we're at the end of this Delta variant and all of the devastation it's wreaked. And thankfully, because we've learned how to treat COVID, because we now have vaccines, because of all of our strategies, it didn't kill nearly as many people as it could have. We know that these vaccines have saved millions of lives. And we know that billions of doses have been given globally, over 6 billion doses, over 250 million doses here in the United States, and millions of doses right here in Los Angeles County. So these vaccines really work, and we see how Delta was not able to provide the full extent of devastation that it could have had we not had these strategies. There's a Mu variant. There may be other variants on the horizon. We'll continue to monitor the situation moving forward. Now we have booster shots, we have third shots, we have potentially vaccines for 5 to 11-year-olds. Will we do this every year? Too early to say. We're still learning a lot, but we have learned a lot as well in the last 15 to 20 months. And that's why we've opened schools. That's why we are getting vaccinated. That's why we have treatments that work now for COVID. So really want people to know that and be confident in that. Next slide, please. All right, so that's basically everything that I wanted to cover today. The most important thing that I wanted to mention is that, the Kedren way, we treat people like people. We meet you where you are. That's why we're coming to your school to make sure that we answer your questions, make you feel comfortable, and then actually provide you the vaccine in your community, where we live, where we work, where we worship, where we go to school, where we play, parks, etc. Why we come and vaccinate people that can't leave their home because they're homebound. That's really our way, where we engage you, we treat you with dignity and respect, and we know that the experience matters. We know that your time matters. We also want to make sure you have all the information, so we spend the time to educate our patients. And then we hopefully will vaccinate you. And we hope, lastly, that you will all become activated. And once we're all activated, we can go on to help our families, help our classmates, our coworkers, our church members, the people in our community also get vaccinated, volunteer, help transport people to a vaccine center, dispel the myths that are out there, all that disinformation, misinformation that literally is killing our community. The facts are that Black men died at 2 times the rate of other people from COVID-19. The facts are that Latino men died at 3 times the rate as those of other people in our community. That's not fair. That's not just. While COVID, quote unquote, doesn't see color, we know that it disproportionately affected our communities. And that's why we're not going to take this lightly. We're going to take this very seriously. That's why we fought hard to get these vaccines in our community and demand that we had access so that we can live, that we can survive and thrive just as much as people from other communities, zip codes, parts of town, etc. So I really want people to know that and be empowered with that information. And with that, I'll turn it over to the school and we can have some questions and answers and we can moderate a small little discussion.
Thank you so much, Dr.